Childhood obesity, it's on the rise. A recent study of nearly 8,000 American kindergartens found 27% of them were either overweight or obese. Some experts say parents have much to do with it. In a 2012 survey, an astonishing 87% of parents of 2 to 5-year-olds did not assess their child's weight accurately.
Many parents do not accurately assess the status of their children's weight. Something like more than 3/4 of them in a recent survey were not accurate about describing their children as overweight or obese when they were indeed overweight or obese.
So why are parents so unsuspecting?
One kind of harsh description is that parents are in willful, total denial. They don't want to see it, so they don't.
And that's not all. Socioeconomics are also a factor.
We know, for example, that for some groups it's harder to prevent obesity. Some Native Americans, like the Pima Indians, have a propensity towards developing diabetes and then type 2 diabetes. Some immigrant groups who come from countries where food is not easily available and where there's actual starvation may see body fat as being an indication of health, whereas in the developed world, we see it as an indication of being unhealthy. Healthy food like fruits and vegetables, especially fresh ones, can be more expensive. So if people are struggling to make ends meet, they may not be able to afford to get foods that we would consider more healthy. They don't train their kids to like them by eating them as the children grow up, and that sets the stage for children picking unhealthy foods as they get older. So what we can still expect to see, certainly in some of these groups, is an increasing level of obesity in childhood. And this is going to lead to increased type 2 diabetes at an early age, maybe even heart disease at an earlier age.
The solution is not an easy one. Dr. Kava says education and major lifestyle changes are difficult, but necessary.
So I think that what we really need to try and do is educate the parents about the truth of what the children might face. And, it can be very complicated. If a child comes from a family in which most of the siblings, maybe even the parents, are overweight or obese, and they have a lifestyle that leads one to expect that, then you're going to have the whole family perhaps change the way they live, at least with respect to food and exercise. So it's a complicated issue, but it is one that we should address as early as possible.
To read more on childhood obesity, check out our website, aksha.org. Don't forget while you're there to also sign up for your daily dose of news, delivered straight to your inbox.